the NHS is reportedly preparing for mass vaccinations in primary schools once approved by regulators. And according to leaked documents, after parental consent, children as young as 5 could be given the jab. Arlene, not just as a parent, but as a senior political figure, what do you make of this?
Well, I was looking, before I came on the show, at the number of deaths in children caused by COVID over this past year, because obviously if there's an issue, we need to look at it. And a study carried out by the National Child Mortality Database based in Bristol found that 25 children died of COVID between February 2020 and March 2021. 19 had an underlying health condition. And of the 6 healthy kids, 4 died of the virus, while 2 died of a COVID complication. Now, why do I say all that? I say all that because the NSPCC then tells us that in this last 5 years, an average of 58 children die under the hands of their supposed carers through abuse, through neglect. And it brings us back to that awful story which we covered of the little boy, Arthur Labinjo Hughes. I mean, children are dying because of abuse and because of neglect, and we're not having a national campaign to save those kids. Why are we not? And here we have more than half, and we're talking about vaccinating our young people. And I think it's something we really need to consider. Now, obviously, children have vaccinations for MMR, for different things, but it's always the choice of the parent, Nigel, and that comes back to the mandatory nature, which I think is very important.
Of course. I mean, we had this big debate about MMR a few years ago in the country, and quite a lot of people chose not to have their kids vaccinated, and then we saw outbreaks of measles. Isn't the point about child vaccinations that we vaccinate our kids to protect them against diseases that could do them great harm?
Yes.
That's exactly right.
Fine.
That is exactly right.
So, but isn't the point here that, and okay, there are 25 youngsters that have died, not necessarily of COVID.
That's correct.
With COVID, and you made the point that 19 of them already had serious underlying health conditions. But isn't the point here that actually, and no one talks about side effects of these vaccines, there are side effects. Pfizer themselves published some data the other week about the numbers of people that had suffered different conditions. I don't get hysterical about this, but we have seen, particularly in young men, a rise in myocarditis, a heart condition. That is true. I'm not making this up, and we've not had much of a debate about it. And the point I'm making, Arlene, is this. Aren't we suggesting that we vaccinate our 5-year-olds not to protect them,
correct,
but to protect us?
Yeah.
And that's why I really, really worry about this. The threat to 5-year-olds and up of this virus is negligible.
That's correct.
To say the least. There is a threat of other complications. Why are we doing this?
Well, I think it's been the discussion right throughout all of this. We're asking people to wear masks to protect other people. We're asking people to social distance to protect other people. So this is actually taking it a step further and vaccinating our children to protect wider society, not the actual children themselves, but wider society.
I thought we're supposed to protect children,
yes.
The other way around.
And the mission creep for me is a real issue. We were told initially it was about flattening the curve, and then we'll all try to get back to normal, stop the NHS from being overwhelmed. The mission creep since last March, when we first went into lockdown, has been significant. It then became about vaccinating the vulnerable, didn't it?
Yeah.
Vaccinate the vulnerable, then we'll get back to normal.
That's right.
Then it was double dosing, and then it was actually not just the vulnerable, but people who are over 50, then people who are over 40, then children, and now, young children. And there's a debate about where this ends. Are we going to be saying, because it doesn't provide lifetime immunity, that we're going to be jabbing kids indefinitely? Every year we're going to be vaccinating children. Now, if that's a debate we need to have, then that's fine. We should have that debate, and we should look at the science, absolutely. But we also need to allow all opinions to come into that debate. And I think at the moment there's a bit of an oppressive atmosphere about the whole thing where people who suggest, look, certain groups of people probably don't need to be vaccinated, or as you just did, Nigel, raise issues about potential side effects. You know, you're immediately dismissed as being an anti-vaxxer and you're on the side of the crank.
Got to have the debate.
There is a way, there should be a way to have a perfectly sensible, rational debate, looking at the science, looking at the data, looking at the evidence, without being told, oh, you must be lining up with cranks. But that's what's happening at the moment, unfortunately.
But, you know, I see it very kind of head-on social media. You know, I've announced that I'm not going to be backing vaccine passports on Tuesday. And I think on a lot of these kind of additional COVID restrictions, if you say that you aren't supporting them, there is this wave of people that say, you don't care about public health, why don't you want to protect people? Yeah. Because, you know, we can't take COVID in and of itself. We can't take COVID just on its own. There are these huge, wider societal impacts affecting mental health, which we know is a huge issue, that we don't seem to give anywhere near enough airtime to.
Well, and let alone, Deanna, let alone the nearly 6 million people now waiting for operations and procedures on the National Health Service. And goodness knows how many misdiagnoses for cancer, heart disease and everything. I'm absolutely convinced that when we look back at all of this, we will decide that the cure, actually in medical terms, in terms of lives and mental health and other conditions, I'm convinced we'll look back at this and say the cure turned out to be worse than the disease.
I think there's certainly evidence out there to suggest that lockdown wasn't necessarily the only route. I mean, if you look at countries like Japan and Sweden, which took a more relaxed, arguably a more rational approach to issues of restrictions and lockdown, and actually seem to have done no worse than many other countries, and in many respects have done quite better than many other countries. The idea that there was only one argument and that was the right argument, but the problem is, most people got behind it. Most politicians got behind it. Most of the media got behind it. So it's very unlikely that those people now are going to row back and say, actually, we may have got this wrong, which is why there's no debate about it.
And they used fear. Just think back on those radio adverts, television adverts, newspaper adverts the government were putting out last year. They were going to kill Granny. But they were using fear and doing it actually very effectively. I think the best example of this actually is California, Florida. Because you've got two states there, both with big populations, both with pretty similar types of weather, and radically different approaches taken. You know, in Florida, keep it as open as we possibly can, albeit, you know, with tables a bit further away at restaurants and, you know, make sure your hands are washed and you know, temperature jab when you go into a public bar or whatever it is. California, which took completely the opposite approach, you know, of locking down and all the rest of it. And actually, when the figures come out, you find out actually California had a worse death rate than Florida. So I'm with you. I think there are other ways of thinking about it.